Hi, my name is Glenda McFadden, and I am in the Infection Control Department as an Infection Control Practitioner. In infection control, we do quite a bit of surveillance throughout the hospital. We look for outbreaks of maybe respiratory outbreaks, gastrointestinal outbreaks that include possibly staff and also patients. No 2 days are the same in infection control. We can be starting out on one path and maybe just a phone call will take our day in a totally different direction. We work closely with the microbiology department also. They have lab results that we need to know right away that could affect patient accommodation, and also lab results that we may need to follow up on right away. When patients have family or friends that visit their loved one at the hospital, it's very important that everyone performs hand hygiene. That would prevent them from bringing anything into the facility and also cleaning their hands on their way out. That would help them prevent themselves from becoming sick. And if their loved one happens to be in any additional precautions, it's also important that they wear the proper personal protective equipment during their visit, depending on what interaction they will have with their loved one, to try and protect themselves. One thing I find very rewarding about my job is the education part, and infection control plays a large part with both educating staff and patients. For staff, if we find that there's a knowledge gap, or sometimes we get suggestions from frontline staff about some education that they might benefit from, then we develop an interactive education plan and we take it out on a roadshow, as everyone calls it, and try and bridge that gap. The most rewarding part I find is with patient education. For example, if a patient is newly diagnosed with C. diff and I enter the room and they're obviously anxious, I can go in there and speak to them, give them our pamphlet, and put them more at ease with their diagnosis. And when I leave that room, I know that I have done my job today and helped in that patient's recovery.